Less than a week into the new year, and we are following, though, this new coronavirus subvariant, which is spreading around the country.
That's right. XBB.1.5 is a spin-off of the Omicron variant and is gaining traction fast. Now, according to the CDC, this subvariant accounted for more than 40% of cases in the U.S. last week. That number has doubled from the previous week. Joining us now is Dr. Celine Gounder. She is an editor-at-large for public health at Kaiser Health News. She's also an infectious disease specialist and epidemiologist and a CBS News medical contributor. Dr. Gounder, welcome. So those numbers are certainly eye-popping when you see that spread. What can you tell us about this new subvariant, and how does it compare to previous variants?
What we're seeing with this XBB.1.5, I know it's a mouthful,
yes.
New subvariant, it's an Omicron subvariant. The main differences are twofold. One, it is more immune evasive, which means it's better at dodging your immune system, which means it's that much more important to stay up to date with your vaccinations, particularly if you're somebody who's elderly, over 65, if you're immunocompromised, if you're pregnant, which is a form of immunosuppression. You really need to stay up to date with your boosters to stay protected against this new variant. The second difference that we're seeing with XBB.1.5 is that it binds cells more tightly, which means it infects cells more efficiently than prior variants did. And that just means it's more easily transmitted from person to person.
I was going to ask who's most at risk, but you mentioned there, folks who are pregnant, the vulnerable, those who are immunocompromised should go ahead and get vaccinated. So we'll clear that for a moment. But what Dr. Jha said about China stood out to me, in that it's not sharing its genomic surveillance data, which means that it's the blueprint for what they're finding, and it helps doctors here figure out the vaccines to match it. Is there any reason to be concerned that we have a new variant and there's not as much data being shared than we would hope?
I do think it's concerning that China is not being transparent about its genomic surveillance testing and data. We really do need that kind of information to better understand how the virus is evolving. Global health, we say global for a reason, because infectious diseases do not respect borders. They will spread around the world. There are some initiatives now to do testing on wastewater in planes, for example, and other kinds of testing for travelers. We might be seeing testing at airports, something I've actually suggested myself before, which would be other ways to supplement the testing we have here in the United States.
So what is the best defense, Doctor, when it comes to this subvariant? Because, over the holiday break, I talked to friends and relatives who told me, I got the vaccine, I got a booster, and I think I'm done now. I don't think I necessarily need to have the latest bivalent. They're not paying attention as closely. They feel as though they have some level of protection, and they're fine with that. What would you say, and again, underscoring what we know right now with the subvariant and the effectiveness of the bivalent booster?
Well, all of the measures we've talked about in the past, the masks, the tests, the treatments, most of that still works. The main caveat there is that the monoclonal antibodies that we used to treat COVID, those don't work anymore. So we do have some vulnerabilities there. But masks still work, the tests still work, Paxlovid still work. And then the other thing I would say with respect to vaccination is that if you're somebody who's young and healthy, do you always need to be getting the latest booster? Maybe not. But if you are elderly, if you are immunocompromised, if you are pregnant, absolutely, please stay up to date with these vaccinations. If you haven't yet gotten your bivalent booster, please do so as soon as possible.
Really good advice, Dr. Celine Gounder. Thank you.